Hello, this is ChappaJack, and for those medical students out there, I'm going to show you how to do a proper brain transplant. Now, for those of you that don't know, brain transplants are the easiest to do in real life. And they're done all the time, and it's really simple. So I'm going to show you what to do here. So first, you gotta get a hatchet first. So you gotta pick up this hatchet. You gotta lose your watch, and we're gonna raise this hatchet. We gotta turn it, and we're just gonna start fucking chopping away. Chop away at the skull. Chop, 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 chop. Look at this. Beautiful. Okay, we gotta dig in there. Oh, and we gotta get the front of the skull a little bit more. So now we gotta get the temporal lobes here on the side, the temporal parts of the skull. Good. And now the frontal lobes. There we go. See, look, we're chopping it all up nice and good. Now we gotta get the occipital lobe in the back here. Oh, come on. We're just gonna chop it up. Maybe we need to dig a little harder with the hatchet here. Dig a little bit harder. Oh, we may or may not have touched the middle part of the brain. That's okay. That happens sometimes during brain surgery. So, we just gotta chop it up some more. That's what we gotta do. We gotta chop it up some more. So, here we go. Chop, chop. Temporal lobes. There we go. See, look, this looks really good. It looks really good. Oh, and if you get the hatchet on the guy's face, that happens sometimes. So we're gonna put the hatchet down. Now we gotta get this needle, which is essentially filled with a bunch of LSD. All right. Oh, we picked up a knife there. That was just to kind of test you guys, see if you're doing the right thing. So we stick LSD in the brain. Got to stick it a little bit deeper in there than most people would think. Now we drop the needle in the guy's eye and leave it right in front of him, just so he knows what's happening. So good. So we chopped up part of the brain. Now we got to get a screwdriver. Maybe not a screwdriver. Sometimes you can use a saw, but for this part we're gonna use a screwdriver here. So here we go. We're gonna pick up. Actually, we're gonna use this buzz saw. Now this is what some people. Oh no! Don't drop it on the floor. Do not drop that on the floor, or else you just will never find it again. So we're gonna pick it up here. There we go. We picked up the saw. Now here's what you gotta do. You just gotta chop off the rest of the skull. You don't really need to care how much blood the patient loses whatsoever. You just gotta chop it up. So there you go. Chop, 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 chop. Oh! See, now this is a rookie mistake here that I was just trying to show you guys that many surgeons make. Sometimes you chop off the occipital lobe, which causes them to lose vision and motor function. So we're gonna try this. We're gonna try this again. That was just a test. That was just a test for all you rookies out there. So this time we're gonna start with this buzzsaw, and we're gonna see what we can do here. So here's what we're gonna do. We're gonna make sure we go in nice and slow, nice and easy. There we go. We're gonna chop up the middle part of the skull. Very nice, very lovely. There we go. See, look, very nice and easy here. The frontal lobe, there we go. See all those bits of skull there that are left on the top after you cut it up a little bit? That's completely fine. That's normal. You don't even need to get rid of those. You can just leave those bits on the brain. People don't really realize this, but when you're doing a brain transplant, you don't really need to be specific or oh, he's losing a lot of blood right now, so we need to give him some LSD. But yeah, when you're doing a brain transplant, you don't really need to be precise. All you really need to do is just make sure that you take the brain out and put the other brain in. That's all you really need to do. So, there we go. We're going to stick him with a needle right in the brain. We've got to stick him in there a little more. And a little bit more. He needs a little bit more needle in the brain. A little bit more. I think that he's good now. So what we just did there was we pumped him full of LSD. Now if you want to try this for yourself, we might be able to pump yourself full of LSD eventually. I might show you that in another video. So now we got to pick up this buzz saw again. And we got to chop up the rest of the skull here. So there we go. Nice and easy. It's nice and easy, nice and precise. We're going to lift it up, move over, and we are going to chop up the rest of the back of the head here. There we go. See, it's a very easy procedure to do. So for all of you medical students out there, brain surgery is the easiest of all surgeries and involves the least amount of pressure. So I would highly advise that you guys, especially people with anxiety and stuff like that, you guys can certainly become brain surgeons if you want to, and do brain transplants. So there we go. We chopped that up. Now what you do is you just start massaging the head a little bit and take it out. There we go. And it'll levitate slightly above the skull, which it's completely normal. So you gotta move a hammer out of the way. You pick up a knife. It doesn't matter which knife. If it levitates on your thumb, that's completely normal. So we gotta be very careful here. Now we gotta cut up the main optic, or we gotta cut off the nerves here that are attached to the spine. So we're gonna cut that up. There we go. Beautiful. Now we gotta move that brain out of the way. We gotta pick up the fresh brain, potentially from an alien source, doesn't really matter. And you pick it up. You pick it up, and you just plop it right in the head if you can. If you can, there you go. And that's how brain surgery is done. No need to reattach any sort of nerves or anything like that. The body will just handle that on its own. And when you attach the new brain, what you're actually doing is killing the old person, which is completely fine, and putting in a new person's brain. Now, this is done all the time, and this is a surgery that every medical student should know. Even if you're doing a specialization in, appendicitis operations, stuff like that, brain surgery is the one that everyone needs to know, and brain transplant specifically, because they're done every single day. So I'd like to thank you very much for watching this tutorial on how to do a brain transplant. I'd like to say please subscribe to my channel if you want to see some more surgeries and tutorials on surgeries. And thank you very much for watching, and I'll see you guys next time.